mi nombre es Arlette, yo soy una estudiante de la Universidad de Fullerton. Hoy voy a palpar los músculos y los huesos de tu pie. ¿Está bien si toco tu pie?
Sí, está bien.
Okay. And I just explained her that I was going to palpitate and that I was going to, and I received her consent to touch her foot. So, okay. I'm going to start off with the medial malleoli right here on this side. Right behind that is going to be the malleoli groove. If you move inferiorly, there's going to be this bony prominence, which is going to be the sustentaculum tali. If you move directly back to this almost like flat-like bone, it's going to be the calcaneus tuberosity. Now, going back to the medial malleoli, you move almost at a 45-degree angle. You're going to be here, you're going to find your navicular. And right here, the most prominent figure of the navicular is going to be your navicular tuberosity. In between these two, there's almost like when you go into plantar flexion, there's almost this deep depression and hole. That's going to be your sinus tarsi. And in between that, the bone that you feel in there is going to be the
head of the talus, which becomes more prominent when you evert and invert. You can feel the talus, the joint of the talus moving. Okay. And then we're going to move up to the toes. I'm going to start off by labeling them all off. We have the first phalange, second phalange, third phalange, fourth phalange, and then the fifth phalange. On the first phalange, we have the distal phalanx, and then the proximal phalanx. The joint in between that is going to be the interphalangeal joint. And between the distal phalanx and the first metatarsal, you can kind of see it's a little bit more prominent here. You're going to have your metatarsal phalangeal joint. As I mentioned, here's going to be the first phalange, the first metatarsal. You have the head, the shaft, and then if you move right below here, you're gonna feel a joint that's going to be the tarsal metatarsal joint, where the metatarsal and the medial cuneiform meet. Moving on, this next one is going to be the same for all toes, from all the phalanges from 2 to 5. You're going to be having right by the nail bed is going to be the distal phalanx, the distal phalanx, the medial phalanx, and then the proximal phalanx. Between the distal and the proximal, the distal and the medial, you're gonna have your distal interphalangeal joint, and then between the middle and the proximal, you're going to have your proximal phalangeal joint. Again, second metatarsal and the second phalange meat is going to be the metatarsal phalangeal joint. It's going to be the head of the second metatarsal, shaft of the second metatarsal, and then you have the tarsal metatarsal joint where the second metatarsal and the medial cuboid meet. No, middle cuneiform meet, sorry. Again, third phalange, you have here the head of the third phalange. You run across through is going to be the shaft, and then the base, and then right here is where proximal to it is going to be the middle cuneiform. And then an important, I guess, vessel that's in between these metatarsals, specifically the first and the second, sometimes it does show in the third, is going to be the dorsal pedis artery, which for her it's right between the first and the second metatarsal. For some people it can be in the third. Okay, and now going on to the fourth metatarsal, we have the, again, head, base of shaft of the metatarsal, and the base, and in here is where the cuboid bone is. Now moving on to the fifth, again, fifth metatarsal, head, shaft, and then the base of the fifth metatarsal, and then if you move right posterior to it, you're gonna feel this bony prominence, which is again the cuboid. Now we're gonna move on to the medial side of the lateral side, sorry, and this is where we're gonna have our lateral malleoli. If you contraflex and invert, this is the prominent figure here. Bony lamina here is going to be the talar trachea, and if you go into contraflexion, this is where you're going to find the talacool joint, which is where the tibia and the fibula meet the talus. And when you go into contraflexion, you can also feel like this almost like these fibers that run across across, and that's going to be the extensor reticula. Okay. Now going back to the lateral malleolus, you have your lateral malleoli. You have right here the lateral malleolar groove. Right below that, you're going to have the peroneal trochlea, which is where the peroneals attach. And then right below on the foot, you're going to have your plantar fascia, which begins right where the ball of the foot is, and then it sort of like webs out through the entire foot. Okay. And now I'm going to move on to the ligaments. Since we're on the lateral side, we're going to start on the lateral side. In here we have the ligament that goes from the lateral malleoli to the talus is to the fibula is the ATFL, or the anterior tibiofibular ligament. Posterior to that, running kind of behind, is going to be the posterior talofibular joint between the distal side of the malleolus and the KNES is going to be the calcaneotibular ligament, and then another one that's going to be between the I think that's it on this side, and then right below, if we're going to push her into inversion, there's going to be almost this fiber, and I feel some fibers back here, which is where you have some ligaments. And right here is going to be the peroneal or reticula. Okay, moving on to the ligaments of the medial side. You're gonna have your deltoid ligament. You're gonna have your tibial tibial calcaneal joint. You're going to have your tibial navicular, tibial calcaneal ligament, tibial calcaneal tibial calcaneal ligament, tibial navicular ligament, and then the subsystentaculum tali and the navicular head, we're going to be having the spring ligament. And then the final ones are going to be the muscles. The first muscle that I have, I'm going to palliate is going to be the abductor hallucis, which helps abduct and flex the toe. So by flexing and extending her toe, I can feel the muscle beginning at the cochineal process up to the sesame bone, and then the lateral base of the first phalange, and then on the opposite side, we're going to have the abductor digiti minimi, which helps with flexing the first toe. Also starts at the lateral side of the lateral process of the calcaneus,
and then attaches up here to the base of the proximal fifth metatarsal. And then we have the last three structures, Tom, Dick, and Harry, which is the tibialis anterior, the flexor hallucis longus, and the flexor digitorum longus, which all run in the posterior aspect of the tibia and the fibula, run across behind the medial malleoli. This is also going to be where the posterior tibial artery is going to be hidden, and it's going to wrap around the posterior tibialis, is going to wrap to the base of the tarsal and the base of the metatarsals. Hallucis longus is going to be the distal end of the toe, and then hallucis dilatorum to the distal ends of phalanges 2 to 4. And then another really important thing that I need to mention is the Ottawa ankle palpitations. This refers to both the medial and the lateral malleoli, as well as the base of the fifth metatarsal and the navicular head. These are important because if the patient or the person feels pain in any of these, in either the base of the fifth metatarsal, the navicular head, or 6 centimeters above either malleoli, it could be indicative of a fracture, which is when we'll need to have an x-ray for the patient.